Children have a lower risk of having severe COVID symptoms, but alarming new research shows if they're infected, they run a high risk for developing diabetes and other dangerous conditions. What can be done to protect them? Time now to ask the doctor. Dr. Anthony Cardillo, Mend Urgent Care CEO and ER physician, is with us now. Thanks so much for joining us, as always, doctor. So while children may have milder COVID, a new CDC study finds that kids who are diagnosed with COVID are significantly more likely to be diagnosed with diabetes and that other condition linked to the virus, that inflammatory disorder called MIS-C. So what is the latest on these health risks that children face if they get COVID?
Yeah, this is a very interesting study that just got released recently, so we're watching this very, very carefully. Now, we do know in general, when children get viral infections, there are these post-viral phenomenon that happen. A classic one is called ITP, where you get a virus and then your immune system attacks the virus and then it attacks your platelets also. We also know that in type 1 diabetes, there's a firm model between getting a viral infection that then induces an immune response that then causes the destruction of the cells in the pancreas. We know this model exists in pediatric medicine. We're starting to see now with COVID infections, there are some sequelae of the actual infection. One of them is this multi-system inflammatory syndrome that happens. It's a vasculitis. All the blood vessels get inflamed. That's why it's multi-system. The vasculature goes to all of the main organs in the body. So we're seeing this sort of vasculitis evolve. And we know this is happening when you get the infection. The key take-home point is that there's supporting evidence showing that a lot of these disease processes, these post-viral processes, are really curtailed if the children are vaccinated. Very important studies came out showing that 91% decrease in the multi-system inflammatory syndrome when those children are vaccinated. Very important study between 12 and 18-year-olds demonstrating remarkable decrease in that syndrome. So the key take-home point here is just getting a mild COVID infection doesn't get you, a full clear pass, so to speak. There are still some post-viral syndromes that can happen. There again, supporting why we have to vaccinate our children.
Wow. And this is an interesting one. Some women have reported changes in their menstrual cycles or irregular periods after getting the vaccine. So what does the latest research show? Are these permanent changes, and is it serious?
Yeah, we were seeing this quite a bit, and women were commenting on this. And most women are really plugged in with that cycle throughout their life and their rhythm, and it's pretty predictable as to when the cycle is going to be. So they were seeing some variability. Now this research is really, giving some credence to that. They're showing that all these women that were studied, this is up in Oregon University, did a very good study, showing that there is some variability right after the vaccine, maybe a day or two where the cycle is off. And we know this because an immune response that's being elicited by the vaccine can interfere with that highly delicate and highly regulated process known as the menstrual cycle. So it's a very highly regulated system that any little tweak, including stress, for example, that can interfere. But this study did show that after the vaccine, you can have several cycles where you are off by a day or two. But the good news is that it recalibrates shortly thereafter.
Oh, well, that's good. Well, today's viewer question comes from Bethany in West Hollywood, and she is fully vaccinated, but recently got Bell's palsy. So Bethany wants to know, should I get a booster shot or wait a few months to see if the Bell's palsy goes away? What do you think?
Sure, Bethany. Now, like I say all the time with any of these questions, it's always wise to consult with your primary care provider who's managing you, who knows you best. But in general, if you have Bell's palsy, that is typically an infection or a response of an infection of the facial nerve that's giving you the motor component to the face. That's why you have that Bell's palsy, that droop. It would be recommended that you don't accentuate your immune system by getting a booster shot while that active process is going on. Again, work with your primary care doctor to really make sure that's the right decision for you particularly, but the recommendation would be that I would give to any patient would be to wait until that clears up and work with your primary care doctor.